Muscular dystrophies. The definition: group of progressive chronic diseases of the skeletal striated muscles characterized by the degeneration of muscle cells with replacement by fat or fibrous tissue. Incidence and prevalence affects approximately 220,000 persons in the United States. Two-thirds of cases are children. 400 to 600 males are born with this disease each year in the United States. The etiology is inherited, defective gene leading to a protein abnormality. There are several types that we will go over here in a minute. Signs, symptoms, and clinical manifestations vary by site and type. Oral manifestations: weakness in masticatory muscles leads to decreased maxillary biting force. Higher incidence of mouth breathing, open bite, and overexpansion of the maxilla. In facioscapulohumeral type, the lips appear thick because of involvement of the orbicularis oris muscle. Increase in dental disease if oral hygiene has been neglected. The types and characteristics of muscular dystrophies. Duchenne's mainly affects boys, occurs before age 10. Most severe and destructive form. Sex-linked recessive trait with high mutation rate. Pelvis, abdomen, hip, and spine affected first. Spreads to trunk, extremities, and myocardium. Osteoporosis also noted. Becomes confined to wheelchair in bed within a few years of diagnosis. May develop scoliosis, obesity, and cardiopulmonary problems. Death usually occurs during adolescence. Clumsiness, frequent falls resulting from precarious balance. Toe walking, weakness of hips, lordosis, cramping of legs and abdomen, Gower's signs, enlargement of calves, and decreased stamina. Limb girdle occurs later, average age 20, affects both males and females. Slower progression in most cases. Autosomal recessive trait. Initial weakness in the pelvis girdle, then in shoulder. May be severely disabled by midlife with decreased lifespan. Begins as pain after exercise, then total muscle involvement. Facioscapulohumeral. Males and females affected equally. Usually occurs around puberty. Least destructive and progresses at slower rate. Least common type. Autosomal dominant trait. Facial muscles affected first. Weakness is asymmetrical. Progresses to shoulder girdle and upper arm. May remain in a state of indefinite remission, with some people living symptom-free, normal lifespan. Mask-like, wrinkle-free, expressionless facial features. Difficulty in closing eyes. Muscles above eyebrow atrophy, below elbow are normal. Popeye effect. Difficulty in raising arms. Myotonic. Both genders affected, appears in early adulthood. Weakening spreads steadily, shortened lifespan. Autosomal dominant trait. Weakness of lower legs and arms and facial muscles. Walking difficulty. May be severely disabled. Cataracts may develop. Stiffness, drooping eyelids and jaw. Frequent tripping and falling.